Hello, welcome to today's webinar. This is a webinar which is aimed at parents and carers. My name's Rachel. I work on the I See the Difference campaign, raising the profile of allied health professions as potential career options. Joining me on the webinar today is my colleague George, who's now going to say hello.
Hiya.
So if you do have any questions throughout the webinar, then please do submit those, and we can either get those answered during the webinar or we can answer them at the end. And George will be monitoring those as they come through. So if you want to wait to the end, that's fine. But if you want to submit them for George to deal with during the webinar, then please do so. So without further ado, then I'm just going to highlight for you the kind of whistle-stop tour through today's session. So basically, I'm going to cover the following things. I'm going to cover what an allied health professional is. I'm going to highlight 4 of the allied health professions which are really needed in the UK. These are shortage professions where patient demand outstrips the number of people in those professions at the moment in the UK. And mainly they don't necessarily recruit so highly because they've got a bit of there's a bit of a gulf of knowledge and awareness really of what those jobs are about. And sometimes the names of those jobs don't particularly help in that regard. So if people don't know about them, then it stands to reason that they're not going to choose them. So I'm going to be talking you through those in a bit more detail. I'm going to talk to you about some things to consider with regards to choosing an AHP as a career. Talk to you about some funding. So that will cover both grant funding to be able to pursue study as an allied health professional at undergraduate level, and it will also include the salaries on the NHS pay scales to give you an indication of what the earnings could be in the different AHP roles, and then just some further contact details. So without further ado, I'm going to move on then, first of all, to thinking about what an allied health professional is. So in a moment, we'll come through to a slide, a couple of slides along, which shows you the 15 allied health professionals. They'll be displayed on the screen for you, and some of them, of course, you probably will already have heard of. However, you might, without this slide, without this explanation, you might have looked at those 15 and thought, well, what on earth unites those together? So I'm going to do that explanation now. So essentially, what an allied health professional is somebody who cares for patients. They are a specialist working within a specific area of healthcare. So they train within that specialism. They're not a generalist, they're a specialist within their field and their sector. But crucially, they are not a doctor or a nurse, and they aren't able to call themselves such, and they never will be that. They are a specialist healthcare professional in their own right. And usually these professionals are providing clinical care. So there are 350 different roles within the NHS, focusing on patients principally and clinical care principally. But some of those are split into job families. So this is a job family of 15 professions, a kind of subset of those 350. So before we move further, I just want to say to you what sort of skills and abilities and kind of personality traits you would need to be a successful allied health professional. So essentially, everybody who is employed by the NHS will be required to demonstrate the NHS core values. And these are known as the C's. So these are about being caring, compassionate, competent, communicative, courageous, and committed. So any applicant that's applying for a university undergraduate or a degree, apprenticeship course as an AHP will need to demonstrate that they meet these values. And also they will need to demonstrate that they meet them when they come to be employed within the NHS. So very important to be able to put other people first, and to really be compassionate, definitely to be courageous, and really underpinning all of it is the capacity that you need to be able to talk to people. You need to listen actively. You need to be able to be constructive in your communication, and also to deal with people who may have communication difficulties. So let's move on. So what do all these allied health professionals do? So we've talked about the fact that they all care for patients pretty much, but what they do is they make sure that adults and children are able to live life to the fullest. And that might be by helping them to live with or recover from health problems. It might be that the patient has got ongoing health difficulties. It might be that they're recovering from an operation. It might be that they've got a specific complaint or illness or disease. It might be that they need help to be rehabilitated, and that you're an allied health professional that's working on the rehabilitation side rather than necessarily the diagnosis and treatment side of things. So they're quite wide-ranging professions, and they're flashed up now on the screen for you. There are 15 in total, as I've already said. Some of these will be known to you, I'm sure. So you can see that there are some therapy-based jobs. So often they're jobs which use things like talking therapies to be able to assist patients with a range of difficulties. There are some other therapist jobs like occupational therapists and physiotherapists who are more focused on the physical side of a patient's health rather than necessarily on their mental health or their mental well-being. And there will be a few names of roles on there that I'm sure you probably have quite a reasonable sense of what those roles are about, such as a paramedic or a dietitian, for example. So they are quite wide-ranging. As I say, each one of those is a specialist in their own right. Now, there is information about each of those professions on our campaign website, which is iseethedifference.co.uk. I would encourage you beyond this presentation to go onto the website and to find out more. So there'll be more detailed information about the other 11 professions that I'm not going to cover in detail today. As I say, it'll just be 4 that I talk about, which are the shortage professions. So I'm going to come on to flag up which of those they are from this 15 here. As you can see on the screen, the ones which were highlighted purple, these are the professions that I'm going to talk us through. I'm going to take each one in turn and talk you through that. And so hopefully that will give you an overview of those 4 in particular. And it might give you some food for thought about whether or not one of those might be for your child. Because, as I say, they do suffer from a bit of a kind of a lack of recognition or a lack of profile in the public domain. So we're trying to address that today. So first of all, I'm going to talk to you about what an orthoptist does. So critically, an orthoptist is not an optician. These are not practitioners that you would find on the high street. They're not principally interested in whether or not you're long or short-sighted. That's the role of somebody else. But what they are is they are specialists in terms of the movement and alignment of the eyes. So they diagnose and treat problems affecting the eyes, and they're interested in how the brain controls the eyes and how the eyes work together as a pair. The sorts of people that they would work with are wide-ranging. So they might work with children. In fact, they do come into schools and screen children's eyesight. There are some conditions which need to be addressed quite early in life. Otherwise, the patient really will have to overcome, will have to kind of continue to have those sorts of problems moving forward. So, for example, if they haven't identified some conditions of the eye by about the age of 8, then the patient is stuck with that condition then into adulthood. So they will work with children's eyes. They will also work with adults. So they will work with adults who have got a specific problem affecting their eyes in isolation, or they will work with adults who've got a problem affecting their vision because they've had another type of illness or condition. So, for example, if a patient's had a stroke not only might it mean that their speech then becomes slurred, but also it might be that their vision is impaired as well. And so an orthoptist could be working with that kind of patient as well. So it stands to reason, where we've already talked about the real requirement for being communicative in your practice. Stands to reason that if you're working with stroke patients who are perhaps a bit anxious about the way in which they now speak, because they've lost some of that control of their speech that they once had. Or if you're working with people with special needs, for example, you know, they may not be able to communicate as freely as perhaps other patients, and therefore you're going to have to be very patient with them. And it's your job really to draw that patient out of themselves, to communicate about their condition and to communicate back to them in a way which is constructive and which meets their needs. The kinds of things that you might be working on, you might be prescribing patches, for example. You might be giving them the patient eye exercises that they would go away at home and practice to strengthen the eyes. Or you might be prescribing a prism in a pair of glasses. So this is a way to actually fool the brain into believing that both eyes are actually aligned. So you put a prism into the glasses, into the lens of the glasses, and then when the light hits it, it bends the light and it fools the brain into thinking that the eyes are aligned, both aligned together. So that's the role of an orthoptist. Let's move to a podiatrist. So podiatrists are lower limb specialists. So they're really interested in the ankles and the lower legs in particular, but they are really rather interested in the whole of the musculoskeletal system, particularly kind of from the hips area right down to the toes. So their main aim is to enable people to get about independently as far as possible without pain in their limbs. Now, where I said that an orthoptist often would work with children as well as adults, principally podiatrists tend to work with adults. They do work with some children if they've got particular long-term conditions. However, mainly it's older people, as well as sports people and dancers. It tends to be older people because we walk about 150,000 miles in a lifetime, and therefore it stands to reason that if we are applying lots of force and pressure to our feet, maybe by running or just walking that distance over time, that they're not going to be in the same condition that they were when you were first born. So there is great scope really to damage your feet and your lower limbs at any point in your life, and therefore you would see a podiatrist try and overcome that. Clearly, if you're a dancer or a sports person, you know, sometimes you're using your feet and your legs in ways that maybe mean that your feet are taking a real pounding. If you think about maybe a dancer who might be trying to achieve that upright position on blocks, a wooden block within the ballet shoe, you know, that's a very unnatural position to strike, and therefore that consistent pressing down of the toes onto a wooden or synthetic block, you know, that spells difficulties ahead, doesn't it, for that patient? So that might be the sort of thing that you would go to a podiatrist to try and resolve. They do play a big role with regards to diabetes patients. So if you've got diabetes, what can happen over time is that the nerve endings in the foot can start to deaden off if you've still got sugary blood going around the system and you're not managing your condition through medication, through diet, through exercise. So they will work with diabetics who are at risk potentially of things going south with regards to their mobility, and their principal aim there would be to try and reduce the need for an amputation for certain. So they will work with those specific types of patient as well. There are some quite interesting specialisms with regard to podiatry. So you can specialise in working with children, you can specialise as a musculoskeletal podiatrist, a diabetes specialist. You can go on with further study to become a podiatric surgeon, so a surgeon of the foot. So if you've got a child who's perhaps interested in becoming a doctor and then later down the track training to become a surgeon, then this could be a different way through to that route You won't be a surgeon in relation to the whole of the body, but you will be a surgeon, a specialist surgeon of the foot. So something to think about there, if that's the kind of pathway that your son or daughter may be interested in. So podiatrists actually will often work in multidisciplinary teams. They will work with doctors and nurses and often with other allied health professionals. And so they often will provide part of a package of joined up care across the NHS, particularly where the patient is high risk or has got acute needs to try and resolve. So let's move on. So this one is about therapeutic radiography. So therapeutic radiographers use sophisticated equipment, which you can see to the left of the screen there. And that's a LINAC machine, and that is a machine which will give doses of radiation to patients who've got cancer. So the bit at the back that looks like the shower head can rotate as required. It can even move under the bed. The bed is the bit which is more in the foreground. So the patient lies on that, sits on that, is propped up on that to have their treatment. And these professionals will see people for short bursts of treatment on an ongoing basis, usually for a number of weeks, could be a number of months. So you do work with patients on a caseload basis. You get to know the patients over a period of time, and you will be putting together their care plan for them in relation to their cancer treatment. Usually therapeutic radiographers within a room will work in a pair, but it's not unknown that they work in groups of 4. So therapeutic radiographers really will be working in hospital environments. They won't ever be working privately in the home because of the type of kit that they use. So they're using the sophisticated technology there to basically try and destroy cancer cells in the body. And of course, what goes with cancer treatment is the fact that for many patients, you can cure their cancer with this treatment. Inevitably, though, you need to be resilient enough to cope with the fact that not everybody on your caseload will have their life saved, but of course they could have their life prolonged and extended. So you do need to be quite a resilient character if you want to be a therapeutic radiographer. Oh, I've just had a message come on my screen. I'm going to ignore it. So yes, resilience is definitely needed to do this job, but it must be an incredible job to know that actually you are at the heart of trying to save patients' lives. You know, it probably doesn't get better in terms of a feeling if you work in the health service than maybe being a therapeutic radiographer. So certainly if people are wanting that cut and thrust, they're wanting to work in acute care, this could be an option that maybe might appeal to your son or daughter. And then the final one I was going to highlight to you is prosthetists and orthotists. So prosthetists and orthotists are usually clustered together, and that's because when you study both disciplines at university. So the main difference between a prosthetist and an orthotist is as follows. Prosthetists replace a limb that is not there. So that might mean that somebody has been born without a limb at birth. It might be that they've lost their limb through accident or illness. Might be, for example, that they're a war veteran returning from a war zone who've lost their limb through something like an IED going off. So you will be working with both types of patient, really. Ones who have lived with the fact that they don't have a specific limb or multiple limbs since birth, and those who might more recently have lost one. So they will be replacing a limb that's not there. So they will be creating a prosthesis, which is an artificial limb. They will be measuring patients. They'll be designing a unique device to fit their body contours and their body requirements. They don't do the fabrication. That gets sent away to specialists to fabricate the limb, but they do the rehabilitation. So when the patient comes back to see them, when the limb has arrived in the clinic, You as the prosthetist would be fitting that, making small tweaks to the device and working with the patient to rehabilitate them. Now let's say that you've been working with a younger person who's lost a limb and you're fitting them with a device. The chances are you'll see that same patient throughout their life over a period of time, because as they grow, they're going to need a new prosthesis. So you really do get to see patients over time, you get to troubleshoot, you get to problem solve, you sometimes get to be a bit innovative with the solutions that you're trying to provide. So the main difference then between a prosthetist and an orthotist is that an orthotist doesn't replace something that's not there. Instead, they use the structure of the body as it is, and they enhance the body by building something like a scaffold or a splint around it to support movement and to maintain a patient's mobility and independence. The sorts of things could be a neck brace, a back brace, a leg brace. Might also be something like one of those braces, but combined perhaps with an orthotic insole that goes into a patient's shoe. For example, if they've got misaligned hips, then that's a simple device that an orthotist could use to fit into a patient's shoe and address that kind of issue. So really, these are tailored services dependent on an individual patient's needs. And so you don't do the fabrication, as I've said, but you do heavily work in terms of the rehabilitation side of things as well. And clearly, for people who've lost a limb later in life, there's the whole psychological aspect to actually get around as that patient and also as a practitioner who would be seeing them. So you do need to be sensitive to patients' needs, but we tend to describe this as a profession which suits people who like technology, who like engineering, who like problem solving, but also are interested in clinical practice. And so it does appeal to quite an array of different students, we find, when we go out to schools and colleges to speak to young people. Now, once you've qualified, you can choose if you just want to be a prosthetist or an orthotist, or if you want to pursue both disciplines. This is a profession that you can do privately if you want to. There are opportunities to set up your own practice. Also, there are for a podiatrist as well, and some orthotists also work privately. The one that doesn't, as I've said before, is the therapeutic radiographer. So hopefully that's given you a good overview and synopsis there of the 4 shortage professions. I'm just going to do a bit of a roundup of why it's good to become an allied health professional. So there's really good employability. So there's over 90% chance of getting a job in the discipline in which you've trained as an AHP. These are really good odds. And particularly as we think about kind of the impact on the economy coming out of COVID-19, that's not going to have an adverse impact on your employability in one of these professions. Because we are seeking to boost the number of people who are going into these health professions. So you shouldn't really be subject to the vagaries of an economic recession. And you can, as I've already said, kind of choose jobs in the NHS and in private practice. There are some professions where that doesn't necessarily fit, as I've mentioned with the therapeutic radiographer. But most people will start out their career in the NHS. That's where you build up your experience and your expertise. That's where you see the more acute cases, you refine your craft, and then later down the track, you might either decide to work part-time in the NHS, part-time privately, or you might decide to work full-time private. And of course, you know, if you're working privately, then you're in charge of your own business largely, and you have to deal with all of the things associated with that, so generating your clients. You won't have a ready pipeline of patients coming to you. You'll have to do all of your marketing and your comms. You'll have to be running a business on business practices, really. So there are options. If you've got a son or daughter maybe who is quite entrepreneurial, who's also interested in caring for people then this could be a good route because it could lead into something which might turn into their own business. So using their care skills and their professional skills as a clinician to actually run their own business. It's an additional dimension that might not appeal to all, but certainly might for a few. You generally work core daytime hours, so it tends to be Monday to Friday, 9 to 5. There are some exceptions, such as a paramedic. Basically issues with patients don't stop at 5 o'clock on a weekday. They go right around the clock. So you will be working on a shift basis for that particular job. There are some opportunities where you can work overseas, so places like New Zealand, Australia, Canada, depending on the local requirements for professional registration in those areas. And as I've said before, you're managing a caseload of your own patients. So you're looking at diagnosis and treatment of your patients. So they're kind of yours and for you to manage in that way and to build up a rapport with over time. Lots of the professions have specialisms, so it would be good to go away and find out a bit more about those. For the entry requirements, we're looking at a range somewhere between 3 C's at A level and 2 A's and a B, or equivalents. So you can find out about the specific requirements for each of the courses by going on our campaign website, icthedifference.co.uk, and finding the course finder. From there, you'll see where the courses are offered in the UK. Click through, it will take you to the individual universities, and the universities determine the entry requirements for students. Also, really good news, we have the return of the NHS grants. So that's a real boost in terms of hopefully people wanting to pursue an AHP as an undergraduate course of study. The sort of salaries that you could command as an AHP are as follows. So the lower limit would be 24,214. The upper limit there is 103,860. So to get to that, we're really talking kind of top of your game in your profession, accepting every single opportunity to progress and really getting to a very senior level within your profession. But you can see there that the salary bands kind of go up incrementally, and anybody who's interested in becoming an AHP would need to weigh up the kind of pros and cons, I think, of going up the scale, as with any other profession. So really, if you're choosing to become an AHP, your principal driver will be to try and help patients. Now, you want to be well remunerated for that, why not? So you will start out at the lower limit, just above the national graduate average, and you can progress up the table depending on what opportunities you seek and take advantage of. But not everybody will make it to the top, and many people will be somewhere within the middle tiers just by going to work and doing their job on an ongoing basis, maybe with a bit of extra responsibility thrown in. But of course, the further up the scale you go, the less patient contact time sometimes you will have. So if you're becoming a researcher, if you're becoming a teacher within the AHPs, then over time, or a senior manager, then over time you could lose that patient contact. So it's a game of kind of weighing up the balance of how you want to spend your working day, and that will be something really that once a young person is in a profession, they will have to think about what their progression route would be and what they can tolerate, what they can't tolerate, and what sort of career path they want to forge out really for themselves. But it's there for the taking, because there are lots of progression routes available to young people. So how do you get into becoming an allied health professional? So the main route for most of the allied health professionals is an undergraduate degree. There are some degree apprenticeships, but they're not all over the country, and they don't apply to every AHP discipline. I would, however, recommend that you check those out because it's a moving picture ongoing all of the time. You can do so at apprenticeships.gov.uk. There are some professions which, some disciplines which you do as a postgraduate degree, and those are art, drama and music therapy, because you have to first of all do an undergraduate degree in those specific disciplines. So you get all of your creative input and your expertise forged in that 3 year of undergraduate study. After that, you do a postgraduate degree covering the clinical side of practice to enable you to work in a therapy-based role. So this is the bit about working with patients, this is the therapeutic side of things, the clinical practice side of things that you cover in that postgraduate degree. However, for the other ones, all of the other professions, the main route that people choose to pursue is the undergraduate degree. So that will be a 3 year undergraduate degree. Placements, so clinical placements are integrated as part of the courses. So typically, you're looking at a blend of workshops, lectures, and clinical practice. There'll be observation within that. The clinical practice is around about 1,000 hours over the course of a 3 year degree. So it really is quite a robust kind of commitment that the university is making to the trainee and that the trainee is making to prospective patients, really. So when you come out on day one, having qualified into your first job, most of the kind of standard complaints or illnesses that patients would present with in your discipline, you will have observed or treated under supervision as part of your clinical placement. So let's think about the funding then, which is available for you to study an undergraduate degree. So you can see on the chart here, you are eligible for grant funding for every year of your undergraduate course for those which are marked purple and orange. The ones which are marked white, there's not funding available for those, but the orange and the purple there is. So why are there also some which are marked orange? Well, those are the shortage ones, and what we've also done is we've rolled into that diagnostic radiotherapy as well, which is struggling to recruit. So if you were to study one of the shortage areas, you actually would get between 6,000 and 8,000 a year whilst you're studying, and this is to cover your general living costs. It's a grant, so it's not, you don't have to pay it back. There might also be some additional funding for you if you apply to a university which is in a strategic region. Now, at the moment, because this is new, we don't have more information on where the strategic regions are. That's a government missive and a government communication that still needs to come out. But it could be, potentially, that you would be eligible for that extra £1,000 a year based on the fact that you might be applying somewhere that they class as strategic because they're struggling to recruit from there. There's also potentially the possibility for childcare support. So if your son or daughter is already a parent themselves, there's potentially the opportunity for them to get some childcare support as well, to be able to cover times when they're studying or on clinical placement. So hopefully this is a really encouraging factor for why people might want to take up an AHP undergraduate degree course. Obviously, it shouldn't be the main driver. The main driver needs to be that you're interested in patient care and diagnosing and treating patients' problems, but it helps. And certainly from a parent's perspective, if you know that there's additional funding there that you can easily tap into to try and reduce the overall debt of your son or daughter, that would be very encouraging, I believe. So what can you do then as a parent or carer? Well, if you've got any networks of people that work in the health sector, not necessarily as an AHP, but if you have got AHP contacts, that's absolutely brilliant. I would suggest to you that you try to exploit those in the nicest sense of the word. If you've not got AHP contacts, but you've got other contacts within the NHS, who might be able to offer volunteering, work shadowing, work experience to your son and daughter. Try and pursue those. There's also the opportunity for young people to do some work shadowing in private practices as well. So you'll not find this for therapeutic radiography, but for the other 3 disciplines that I talked of, which were the shortage professions, you should be able to find some private practitioners. Obviously, you cut through the red tape if you're approaching somebody working in private practice to ask them if your son or daughter could do a bit of work shadowing. Whereas if you're going through a hospital trust, clearly there are different hoops to jump through to enable you to go and work in or work shadow in a hospital environment. But it is worth pursuing, because what I would say is that these courses require people to kind of stick with them and to stick in the professions, because we've obviously got a national need for all of these allied health professions. So it makes absolute sense that you, as a parent and your son or daughter, find out as much as you possibly can about these professions, and what better way to do that really than to do some work shadowing or work experience. As we come out of COVID-19, it might be that you get a flat no from professionals in private practice because they're trying to resurrect their businesses. But it is worth a go, because even something as simple as having a quick chat with a practitioner over the phone or via something like Teams or Skype, that can benefit a young person in terms of their overall knowledge. And actually it can have 1 or 2 impacts. One might be that they think, actually, do you know what, that's not my chosen career path. It's made up my mind, I don't fancy it from the sound of it, but hopefully it will be, oh, that's really lit my fire now, I'm really interested in that particular profession. So ruling things out is equally as important as ruling things in, I think, and that's what I say to young people. So try and get that sort of opportunity, try and secure that. If you're approaching somebody in private practice, you will absolutely need to check out that they are legitimate. So all allied health professionals have to be registered with the Healthcare Professions Council. Do check that out, see if they're legitimate. And also you want to do your own sort of safeguarding check to make sure that you're happy with your son or daughter going and observing a practitioner, possibly alone in a private practice. I know a lot of practitioners are very, very happy to help in this regard, because they're really keen for the next generation of practitioners to go into those chosen career paths. So ask, do ask, don't be shy about asking. It's definitely worth doing, and I would really recommend it. I guess as a parent or carer, what you're going to want to do is to think through with your son or daughter if a degree or a degree apprenticeship is the best route. So really one of the advantages of degree apprenticeships are that you can perhaps pursue them without needing to leave home. And so that is possibly a way of reducing cost. The flip side, of course, is that you're not kind of necessarily standing on your own 2 feet fully if you're still living at home. And also there's not nationwide coverage of degree apprenticeships, but for many people these are a really good option for pursuing their career aspirations. Whichever pathway they take, your son or daughter would be supported and mentored and trained for that specific career. And there are lots of transferable skills that they would gain by studying this sort of discipline, these sorts of disciplines as an AHP. So where can you find out more? Well, our website, iseethedifference.co.uk, contains all sorts of information. It gives a synopsis of the 15 professions. It gives you that course finder, which shows where the courses are available in the UK. And by clicking through, you can get into the individual university websites. If you have specific queries about an individual type of course, let's say that you are interested in studying podiatry at the University of East London, for example, then your best bet would be, if you've got a specific course-related query, to make contact with the admissions tutor on that course. They're going to be the experts in terms of what the entry requirements are. They will have an overview of what that course entails for the student. They'll be able to give you a breakdown of what you might study in year 1, 2, 3. They'll be able to say to you how many people go on to be a podiatrist at the end of the course. And they may also be able to point you in the direction of where you could search for some work experience or work shadowing. So do exploit admissions tutors' time to try and find out more, because they will be very happy to do that. That's their job. Do email us if you've got an inquiry at info@icudifference.co.uk. And you can, of course, follow us on Twitter, Facebook and Instagram. Now, one thing that we are doing at the moment is we are in the process of compiling some lesson plans, and some of these will involve self-directed or independent learning for young people to do, and they will be profession specific. So, for example, I've done a couple on podiatry. I'm now doing some on osteopathy, and my colleagues are putting together some on the rest of the disciplines as well. They will be on our website, maybe not immediately, but in the coming weeks, months. So do have a look at those and try and direct your son and daughter to perhaps doing some of those activities as well, where they can find out a bit more and delve into those professions a little bit more. So thank you very much for listening. I'm going to defer to my colleague George now, just to see if we've got any questions.
No, we don't have any questions come through just yet. Don't know if anyone has any burning questions before we finish up.
Yeah, so if you do have a question, now's your time to submit it. George, do you know if the webinars are now live on our website?
Sorry?
Do you know if the recordings are now on our website?
So they're not on our website just yet, but they will be coming up soon.
Okay,
so it should be a week.
Yeah. The other point I should have made to you as well is that over the coming weeks, we are doing some profession-specific webinars. So I'm doing another 2 podiatry webinars. George, you're doing orthoptics ones, aren't you?
Yes, that is correct.
Yeah. And there's another colleague who's doing some on therapeutic radiography, and another colleague who's doing some on prosthetics and orthotics. So if your son or daughter is interested in those 4 shortage professions, try and check those out. So the format of the ones I'm doing, for example, for podiatry, are where we have a real life podiatrist there. I field questions to them, they give their expertise, and we also walk through some of the types of slide that you've seen today. So if you are interested, please do check those out, because we'd appreciate you flagging those up to your son or daughter. So if we haven't got any questions, George, I guess it's time to conclude.
Yeah, no questions have come through.
Okay, well, thank you very much for listening and staying with us. That's been great. I hope you found it useful. There will be a feedback form being issued to you. If you can give any feedback that can help us to improve our offering or our presentations, please do submit that to us. So thank you very much, and I wish you a pleasant afternoon. Thank you very much. Bye.